Hare Krishna, welcome to our broadcast live with the GBC SPT. It's my great pleasure to have with me today two very senior members of our Mayapur community, Dr. Vinaya Gaurachandra Prabhu and Hari Leela Prabhu. And I believe we're also expecting Dr. Sukhi Achyuta Prabhu to be also joining us. In the way of introductions, basically, Hari Leela Prabhu is one of the members of the Mayapur Administrative Council, and specifically, he also has a number of portfolios, you could say, including the Mayapur Community Hospital. Dr. Vinay Gaurachandra Prabhu is part of the team that serves that effort, but you especially have come into our Mayapur circle because of your relationship with Jayapataka Maharaj, correct? You've been part of his care team. Maybe just before we get into a bunch of questions, I'd like to. So you came and you got stuck here, or it was a plan to be here? Because I know you were here just as this pandemic started arising. Was this already part of your program to move into Mayapur, or this was something
right
Lord arranged?
There's a plan, right? There's a plan to go back in about March, but it seems it was probably not a really feasible thing to be able to leave after March 22nd or March 23rd. So we've been here since, and so it's been serving along underneath.
Well, we're lucky. We're lucky that you could stay because you've been such an invaluable member. I do have one more person to add to our group here. That's Santanu Poder, and it looks like he's there, but he doesn't have his video on yet. So I'm going to just Santanu, when you get your video on, I'll see it, and then I'll bring you back onto the stream. Good. So we have lots of questions, because this is a broadcast to serve the entire ISKCON world, and Mayapur is our home for every devotee, and so there's so many concerns and thoughts. What's happening in Mayapur? So let's just start off. What's your perception? What's the situation? What is how are things going on in Mayapur in respect of the COVID pandemic, particularly? So, whoever, Vinay, would you like to lead us off?
Well, perhaps Hari Leela Prabhu can start, and then I can join in afterwards.
Okay, so it's over to you, Hari Leela.
Yeah, Hare Krishna. First of all, I would like to thank you for having this session. I know that all over the world, people are watching Mayapur in different ways, and always people are having great concerns that what's happening in Mayapur is good. Everybody should be concerned about Mayapur because that makes Mayapur conscious, and that's good for us. That we have to be Mayapur conscious, we have to be non-conscious. It's good for us. I'll just trace back a little bit on history when I can pitch in now and then. Way before governments started tightening the rules, and way before governments started doing anything serious about, I'm saying governments, not government, governments started doing anything. Mayapur was actually doing something. We started, if I remember correctly, Vinay, we started end of January, right? That we were that's
mid-January. Mid-January. Yeah.
That's the time when actually this news was going around, and people were busy coming to Mayapur, and we were actually in a hot debate what to do with devotees from China, because that time China was the epicenter of what would later be known as a pandemic. But during January, there was no talk of pandemic. There was no talk of travel bans. There was no talk of restricting movements of people, except that we knew that Wuhan is in the lockdown, etc. So we moved with Chinese GBC, and then we had a lot of talk with them, some back and forth. And then they told us that it's okay if you tell us not to come, we won't come. They were very proactive, and that's something I would like to appreciate on record, that they're very sensitive, they're very proactive, they understood the situation, and they responded accordingly. And then we said, please don't come. That's it. So they put their shutters down, and then we started looking for devotees who could possibly be coming from there, and then did some contact tracing, etc. And then told them to isolate. This is all we're talking about mid-January. These things now looks like, some household words, but that time no one was even thinking about these things. So that's the time we did these things. And I think there is a video of Gaur Purnima, the day before or on Gaur Purnima day. I was announcing on the crowd that you have to wear masks, you have to keep social distancing. If you have flu-like symptoms, please report to the hospital. We sent out different early mailers of COVID symptoms, etc. So we were way before the whole world started waking up to this pandemic. We were way before acting in a way which is highly responsible. And also, due to various measures which was taken by Mayapur management and also the doctors team, we had, and of course by Nrsimhadev's mercy and by Mahaprabhu's mercy, we had a Gaur Purnima which was very eventful, but it was eventful in the right sense. And then all devotees went back home, and we gave a big sigh of relief. Yes, devotees have gone back. Now, okay, it's okay. We can face this world. Whatever happens, we can see what happens. Then the whole thing rolled out. The whole world woke up to the pandemic. It was announced to be a pandemic. Lockdowns came in place in the end of March, and some devotees were stranded here by the time still. So then we started the whole protocol of how to help different devotees who were stranded. It took some time for us to put our act together. We figured out what to do with them and how to help them. We wanted to give them prasadam. Then prasadam was very spicy. Then we figured out a group who can cook them nice non-spicy prasadam. So many things were put in place to make devotees comfortable, to take care of devotees who are already here. And then the biggest challenge is how to face the shutdown or the lockdown situation. So continuously we had hours and hours of meeting. My wife was telling me that everyone is saying there's lockdown, but you guys are looking like working more than anybody else on lockdown. What is this? So I told her what to do. We have a big community to take care. We have a big community to manage. So all the MAC members, they spent hours and hours in deliberation and meeting the different managers of the different divisions, the different bodies, MDC, Brahmachari Council. Everybody pitched in, and we had lots and lots of discussion, lots and lots of meetings to actually, and then we took some real hard decisions as to what needs to be done to face this very unique situation, which probably in living memory none of our generation has faced. So here we are today in Mayapur, zero casualties with COVID. A community which is reasonably and fully educated, a community which is aware of what they are facing, and then some good doctors with grand experience of what it takes to pull out people if they're affected, and then we are now ready. We are battle ready. We know what we are doing, and then. We know that it is a continuously evolving situation, and we are alert and we are ready to go.
So Vinay, I'll turn to you and ask about dealing with COVID, because I think let me put both of you on here. Dealing with this situation, as far I've been here also lockdown, and as I recall, we were pretty much as a community free. We were following, the lockdown protocols. We were isolating. There was a month where we were all just in our houses, which the whole of India was, and we kind of were going along, and then, as the nature of this virus is, it started, somehow or other, it came into our community, and there have been some cases. So tell us, Vinay, what's been your experience? You have a framework set up for dealing with COVID cases as they've arisen. Maybe we could hear a little bit about that.
So I'm part of, so the way that Hari Leela Prabhu and Guru Maharaj and basically they've been sort of engineering this thing is, we've been going along just to make sure that, we started, like Hari Leela Prabhu said, we started in January, mid-January. I think there was one post on January 9th that was made on our, we have a little group with the GM Healthy, and after that, I think it's been sort of, the way that Hari Leela Prabhu, the way that Guru Maharaj has set it up is, first thing is prevention, the second thing is proactive treatment, and then the third thing, of course, is prayer. So all the 3 Ps, and I think that's been the mantra that they've gone through the whole time. And of course, Sukya Chitta Prabhu has been in tandem with Hari Leela Prabhu on the ground, have been on the ground, and I've been sort of telemedical. And Santanu Prabhu is also an incredibly strong part of that, and a few other doctors. So I'll talk about the proactive part of this. The proactive part of this was the messaging that went out in the beginning. And I think in the beginning, the 7 different ways was actually 21 different ways in order to convince others and even ourselves about, the gravity of this when it started off in China. And then thereafter, when it did start to come our way, we were already telemedically treating people with Ayurvedic therapies, with prevention, and this is sort of Guru Maharaj's brainchild. As far as every night we would meet and we would talk about 15-20 minutes about the scientific efficacy of different interventions that were there, and on both the allopathic side, the Ayurvedic side, and sometimes even the naturopathic side. So sort of stretching my cognitive abilities. Acharya Ratna Prabhu's also, and saying, hey, look beyond the horizon to say, what is it that we can do, because there's no cure. So our team, we have a Nitai team that who works with Hari Leela Prabhu. We work together, and we went through all 300 clinical trials to figure out, what are the things that are up and coming around the world, and what are the clinical trials that are out there worldwide in both an allopathic and Ayurvedic thought process that could be efficacious for us. So there were monks that were treated in Bangladesh. There were people that have been treated across the world in the UK, United States, and we started to gain experience in that way. And so immediately that knowledge sort of brought back here. So I think that we had a good running start and an understanding, because if we were to have any difficulties, we've seen them in the hospital already abroad and whatnot. I've seen COVID since the beginning and seen the sort of impact of it neurologically, and then of course in the ICU and other ways, pulmonary and other system-wise. And so I think that again, so prevention was done, so the proactive treatment was done, and then of course the other part of this is prayer, which is in one of our studies we actually studied the effects of Hare Krishna Mahamantra on a group of monks and how they were able to lower their anxiety scores by close to 2 to 3 points. So interesting thought processes with a good clinical significance. So we actually have publishable data in all 3 arenas.
That's very, very interesting. So I'm hearing that before you even started dealing with COVID in our community, you were already dealing with patients around the world and discovering the efficacy of different treatments.
So it's actually an interesting conversation. Yeah, go ahead.
So now tell us more about I think as far as I understand, the first COVID cases came into our community somewhere in July. Is that correct? That we started.
So I'll let Harilila Prabhu and Sukhicita Prabhu go ahead and address.
Santanu, you're here, but you don't have a video. But I can add you if you want to say anything. Just type something in the chat stream and let me know, and I can and bring you in. Or if you want to, because he doesn't have a video, but we could hear him.
Yeah, somewhere around July, we had some devotees started reporting flu-like symptoms, and then they started saying that they have fever, they have running nose, they have cold, etc. Then by the time we were already ready, Dr. Sukya Chutta, we had a plan already set in the ground that we wanted to convert Vamshi into a makeshift hospital. So that plan was already set by the management. We already had it in our mind that if something happens, then Vamshi would become a hospital. So with that in mind, we started actually using Vamshi for isolation. So when the lockdown started, even that time, Vamshi was being used as an isolation building. Any devotees who would come into the campus, they would straight away go into Vamshi and then they would get isolated there. And then they would spend their isolation period. Grahasthas would spend their isolation period in their own houses. Brahmacharis were coming from their different preaching fields, because there were so many coming from their different preaching fields, like birds returning to nest. So many were coming. So they would all go through isolation of 14 days in Vamshi. And this we are talking in the beginning of lockdown, when there was no COVID case anywhere, but still our protocols were quite strict, that people would go through isolation, observation, etc., etc. So Vamshi was a natural choice. It was converted into a makeshift hospital. Dr. Sukya Chutta, who joined us in February, he was, sometimes I would feel that Mahaprabhu sent the right people in the right place, like Dr. Vinaya was there, Sukya Chutta came in, and then Shantanu and Gopijana were there. So we decided a strategy that Sukya Chutta would take on cases outside, and then our Dr. Swami would take on the cases inside the hospital, and we would actually barrier the hospital from any COVID treatment in the beginning. So that was the strategy, and that strategy worked very well, because we had a safe cocoon in the hospital with which we could fall back for other cases. And then Vamshi was our COVID hospital, we could say. And then Vinay and Sukya Chutta started treating. Vinay was giving consultation from telemedically. Sukya Chutta was running around, and then he is. I wish he joins very quickly. He's one confident doctor. Um, he took on COVID very nicely. He was quite confident that he could take on it. And then Vinay and Sukya Chutta went through a lot of literature. They hashed out the treatment modalities, what should be done, what should not be done, with great support from Shantanu and the Gopijana, who are there from hospital, and then our nurses. Of course, now looking back, it all seems to be a good thing to talk, but we had sleepless nights. They had sleepless nights, sleepless days, sometimes going straight out. But because we were so alert, and we had educated the community that what should be done, and the reporting was quite good, we could catch almost all of the cases early. And that's something which the doctors would say that that's so precious, to catch them early and then treat them aggressively. Not only just depend on allopathic treatment, include naturopathy, include Ayurveda, all these different things, and diet. So we had sent out communications to the community, what should be done, what should not be done. We did constant updates with them, and community, they were also quite eager to follow what we said. So overall, it was a great team effort, I would say, between different parties. And then we had gone through one phase. Of course, Dr. Majumdar came in. He is our regular doctor who used to come from Calcutta. He came in, and the devotees rose to the occasion. They formed care groups which could deliver care. Brahmachari had their own care groups. Then community came up with some support. So overall, like, everyone was hand holding with each other, and the doctors were working round the clock. It was really a tough time, but because there was so much of cooperation and because there was so much of understanding between devotees, then that phase went through nicely, and now we are in the phase where the country is unlocking continuously. Unlockdown 1, unlockdown 2, and lockdown 3. We are continuously preparing. We have even now, Dr. Suki is late for this interview because he was in Calcutta hunting for some important equipment which is needed, and then hopefully he will join in another 10 minutes. Then you can hear from him also. He has a lot of stories to say from his experience. So we are continuously preparing. We know that the pandemic is not over. We know that as the unlockdown, which is inevitable, is going to happen, and we know that people are going to come. That means that there is a possibility of a second wave, and no one knows what is going to happen in winter. I think there was a Game of Thrones kind of thing that the winter is coming. Yeah, like that. We are also having that caption that winter is coming. So we don't know. No one knows what is going to happen in winter. Of course, there are many theories. Vinay could actually speak on those theories. But we know that this is not the time to let the guard down, and we are continuously preparing. At some point, I would also speak about those preparations.
You mentioned a little bit, Harilila Prabhu, about the different modalities for treatment. And Vinay, you also talked about this earlier, that you'd been exploring, and actually you've been doing some clinical studies. Are you using this? Is all the data that's been gathered through your experience here, is that also being used to support some of your experience here? And what's worked? What are the things that you feel like? We heard about early intervention being a very special part of that. Tell us some more about what you think has been working especially well in our community, and what perhaps others can learn from.
Well, I think clinically, if I can speak to this, clinically, I think we understand that just around the world, early steroids, early detection and early intervention helps. Now, one thing that we know in Mayapur is that it's different from the rest of the world in that we do have a wonderful community hospital. We have one ventilator that's here, but the issue is also if we can do early detection and not allow the patients or our patients to go to the point where they need that ventilator, that's great. And so that has basically been the key. You had asked, and I think you had alluded to in a couple of questions, does immune boosting help? And in my opinion, clinically, from what I've seen, and these are from, obviously, this is not a randomized controlled clinical trial, which is the highest power study that we have. I mean, these are people that are getting sick that we're treating with these things. We found that patients do state that they're helped by certain Ayurvedic medications, and they feel that the breathing improvement has helped by certain patches on the wrist where they feel that they've had some improvement on that. Different sorts of medications that I wouldn't have considered before. That's number one. Number two is and from going from least effective to most effective. Number two is that they found this sort of Ayurvedic drinks to be very helpful as far as being able to help them to breathe or even calm the nerves so they can breathe. The third thing itself is actually chanting itself that they found. Like I said, it actually helps them to calm the nerves so they can breathe, because breathing is important. The fourth thing in importance is probably the steroids. And then the fifth thing is probably starting up, these medications called favipiravir, which are the antivirals that are previously used for Ebola, that are now used and treated for SARS-CoV-2, which is coronavirus. And those are sort of the 5 levels. You have the anti-inflammatories like remdesivir and the other medications. So the list that goes on and sort of in this upslope. So what we've seen is that the Ayurvedic medications and the exercise and all that definitely helps. Those people that are fit before end up, in our experience, doing a lot better. And I think that's a worldwide experience also. And yes, thankfully here in Mayapur, we can knock on wood.
So coming back then, do we have some numbers? I mean, I think people might be interested. How many devotees have been sick so far? How many have recovered? Have there been any close calls? Have there been any devotees who got pretty close there, needed to go on? Like you said, you haven't had to use a ventilator. I think that's a great news. But hospitalization, you mentioned that there's like a hospital environment that you've created to treat these devotees. But can we? I know this may be too personal, but if there is something, we hear the numbers every day from the Indian government and so on. Do we have some numbers from the Mayapur community that can be shared, or is it just something you'd rather keep it?
So, Prabhu, do you want to talk to the numbers inside and outside? So there's 2 worlds that exist. Do you want to go ahead and start, or would you like to take it, or do you want me to take it to what I understand?
Yeah, numbers. We had good numbers, I would say, without going into specific numerals. We dealt with good numbers, both inside and outside, like the inside world and outside world. There's good numbers. Yes, few close calls, which gave us a lot of anxiety. A few close calls.
Santanu Prabhu was up all night. Harilila Prabhu was up all night. Yes, and Sukhyachuta Prabhu maybe pulled an all-nighter for a week straight. I don't think he slept for maybe 3-4 days straight, and during those times. And so it's there were I think 3-4 cases that are pretty memorable, out of all of the cases that are out there. There's definitely a significant number of people that were affected, but I would say that the incidence rate here, and the incidence rate here is less than the incident rate on the outside, and that's really good.
That's very good. And is it a trend? Do you see a trend? Is it, there was we see in the outside environment, there's sort of spiking and then it comes down. There's been any sort of curve here?
I've seen the, if you were to take it on a severity, I think our community somehow, because of this early sort of understanding and the early push, and whether you call it anxiety or paranoia about this coming in, I think our community has been superiorly attached to doing well through this, and that's the thought process. Because I think we've had some pretty prominent figures who unfortunately didn't make it, maybe on the outside of the community, and so that sort of alarmed everybody to really, if they have symptoms, they alert quickly. I think Harilila Prabhu said it very quickly. And once they alert, we're so quickly on top of them. I think Santanu Prabhu and I think we just go into straight go mode. And I think Sukhyachuta Prabhu and then Harilila Prabhu will stay back and look at the big picture and say, should we do this now rather than wait 3 days from now? He'll chime in and say, instead of starting that medication, he said it on a couple of occasions, like, why don't you just start it now before he goes into that situation? And nonetheless, that is the deciding move that makes them not go to the hospital. Because the fear is And the concern is, from our experience, is that once they go to the hospital, especially in India, from what we've seen, loss of life is very, very probable.
Okay, so that's significant, that being able to treat here in our facilities has made a big difference.
Yeah, that's one thing.
Santanu is got his camera working, and so I'm going to just add him here and welcome Santanu Poder, who we've heard your name a few times. You're a key person in this whole COVID management. Tell us a little bit about your role. What's your service in all of this?
My service is just follow the orders of the doctor, make sure all the facilities are going to the patient, and there is no delay. Like the moment we get the alert, make sure each and every facility with nurses, with proper medications are reached to the place where the patient is and get the treatment on as per the doctor's requirement.
Well, and that's been working. I mean, we have to thank you for doing that service, and our community is indebted very deeply to all of you.
Although Santanu
go ahead.
Although Santanu makes it sound very easy that my service is just to follow the orders of the doctors, but the orders of the doctors come at 11 o'clock at the night, at 12 o'clock in the night, at 1 o'clock in the night, and it's not like just go and deliver this medicine here or there, but it may be sometimes lug a whole oxygen cylinder and run and things like that. So these boys, they have done wonderful job, Shantanu and Gopijana. They have done wonderful job with the nurse there. They have not seen day, night. They have not seen their families. It's quite a job just to follow orders of the doctors. It's not, even though he made it sound very easy, like, it looked even glamorous. He said that, just follow order of the doctor,
Well, but then your front lines. That's one of the things that I remember hearing from very early in the days of COVID pandemic here in Mayapur, is a special prayer. I believe it was composed by Srila Jayapataka Maharaj, where he talks about frontline workers and praying for them. And I think you're all part of that, especially Santanu. I guess you're right there in the front lines. And the front lines are not easy, not easy. So thank you very, very much. Any of you, to help us understand, what are some of the special challenges that you faced in I mean, you've mentioned a few things, but anything that stands out that's specific to our Mayapur community that you would consider to be a challenge in dealing with the COVID pandemic here?
So when I could speak on medical challenges, I could speak on social challenges.
Okay. So who goes first? Vinay?
Vinay, go first. Okay, I'll go.
Okay.
So let's start with social challenges, because Mayapur is a very diverse community. So the whole world is here. So because the whole world is here, it's also a boiling pot of all kinds of opinion, from far left to far right to middle left to middle right to center, and whatever you want to call left, right, center, top, down, bottom, all sorts of opinion. And devotees are quite articulate in expressing such opinions in a very diverse community. So from beginning, as a management which actually manages community, we took a very sober stand to actually deal with all these different opinions, mostly without getting anyone feeling disrespected of their opinion. So our stand was simple, that everyone is an intelligent devotee. Everyone has their right to think and act in an intelligent manner, in a way that they feel that it is right or wrong, according to their well-researched understanding. So we would not get into a debate. Rather, we would simply discharge our obligations placed on us as a public institution by the government, which we feel is important in order to keep this place running and keep this place open so that everyone can take advantage of this place. So that is the stand we took, and that stand has worked quite well, because we are not taking a confrontational stand. We are rather taking a stand which is reconciliatory, so which, and also quite neutral. So I think that's a very important way of managing a very diverse community with diverse opinions. Um, of course, in the beginning, there were some strong opinions expressed by different devotees, and then I think somewhere in the middle of the pandemic, we wrote our communication department, our MAC member Subhakshana Prabhu. He composed a very nice message and sent it to the community, explaining very succinctly what is the stand of the management. And also other MAC members, like Vinay Gauranga Prabhu, who is in charge of security, is very important service. He has been constantly training and instructing the security as to how to deal with this pandemic situation, how to deal with devotees, how to deal with patience and understanding, where to be firm and how to be firm, all these different things. Of course, always something comes up, but the beauty was that whatever came up, it was all dealt with. So that, I think, makes a big difference. Same way, the other two MAC members, Nitai Padakamala Prabhu and Madhavari Prabhu, they were continuously working with the brahmacharis, trying to educate them, trying to tell them that what they should do, what they should not do, how it is important for them to follow the different rules, how to live safely as the inmate, as the ashram, how to actually help each other, how to save each other. Lot of work done by our people in educating everyone in the community. Of course, like every community which faced compliance issues, we have also faced compliance issues. I would not deny that. It would be unrealistic to say that we never face any compliance issues. But what is more important is that we kept on pushing this compliance from beginning, and then we had sometimes some rewards, some reward system, sometimes some system of certain denials of privileges, etc. Overall, it has been working very well, and I can very safely say that we are moving towards, if not 100%, we are moving towards 90-95% compliance. But we are constantly aiming at 100% compliance in public places. But there may be some occasions, someone may say that, oh, on this occasion it was like that, on that occasion it was like that. I don't deny that there may be some occasions, but they are occasions. They are not the standards. The standard is that there's good compliance, and then there are occasions where there could be some challenges which are seen. But sometimes occasions are which is more visible, and standards sometimes may be less visible. That's okay. We are not working for visibility, even though sometimes visibility is important to give a message. But at the same time, we have a responsibility to deliver this community safe situation, and that's what we are trying to. That would be the social side, I would say. Medical side, maybe when I could speak.
So I think.
Pacharatna Prabhu, you are muted.
Am I muted? Am I?
Now I'm yes, I'm sorry. Yeah, please tell us more about the unique challenges, perhaps specific challenges that you feel were here in our Mayapur community from the clinical
So
perspective.
from a clinical perspective, I have to really applaud Harilila Prabhu about this. This is Harilila Prabhu is an engineer, and his engineering background is pretty firmly backed with safety science, and so I think that this has really been helpful. And his analytical skill is pretty phenomenal. And we've worked together, I think, for about 5 years now with His Holiness on the GM Healthy team. And sort of had, as we've gone on, there's two tiers, I think, that have come along, and Sukhi Chitta Prabhu, I think, will agree to this, is that the first thing is testing. Testing was a challenge in that, not in that we didn't have it, in that what was the actual false positive rate, what was the true positive rate, and to get that under control. And Sukhi Chitta Prabhu has done a phenomenal job of doing that. And then, of course, Hari Lila Prabhu bringing in the actual testing for the RT-PCR was our challenge. The thought process of, okay, patient has a symptom, and if they test negative, are we going to still treat them as if that's there? So I think we basically took the stance in this challenge of figuring out who is really positive for COVID-19 and who's not. Is everything that, that sneezes or anything that blinks, is that COVID-19? And that's been a concern of ours, because you don't want to over-treat, of course. And then on the other extreme, you don't want to under-treat. So we've maintained a balance in that way. And even though sometimes we don't want to, because, there's differences. There's also been a challenge, I think, if I explain to you where I stand, I'm in the Conch building, in the Lotus building, and I serve on the same team as Acharya Ratna Prabhu underneath Guru Maharaj as his physician, and I'm working as his neurologist, whereas Acharya Ratna Prabhu is working on all the other areas as an excellent physician. And so one of the things that we have to do is we're under quarantine, very strict quarantine. So there's been some social issues where I have staff, and Hari Lila Prabhu has addressed that, where some of the staff members, some of the people need more training and education. And I think that that's true of the whole population as a whole, because sometimes they just don't understand until they actually see the disease, until you look at the disease and you've seen a patient with the disease or you've experienced the disease, you may not believe it. And so that's one problem. Hari Lila Prabhu has addressed that. I don't think that that's as true in our community anymore. The second part, like I've discussed, was the testing, understanding if what the accurate testing is. Hari Lila Prabhu has brought in the actual test and has raised the funding for the actual test that we need to be able to move and make conclusive decisions upon that. And I think the last challenge is what treatment is efficacious versus not. There's new treatments that are coming in, and they're not, and there's some treatments that we've used that even before the clinical studies have come out, we just started using them because we thought that it made sense, and thankfully it went along. But of course, if you treat somebody with these medications, these are potent medications that have potent side effects. So if you treat somebody and you don't have all the data you need, that is a sincere challenge. And then if you're also going against the flow, and there's flow forces in opposition where one country is saying, no, this doesn't work, and another country is saying, yes, this does work, your patient is in the middle of that. So we have to make a very, very razor's edge decision on are we going to threaten our patients' lives with doing this treatment or not? And so that Sukhi Chitta Prabhu and I always have these transcendental conversations regarding these treatments, and should we treat or should we not? And it's all it's all with the patient at the best interests, and the patient's best interests at heart. But sometimes even us providers, we don't agree because we're coming from a different understanding of the literature. But in the end, it's worked because maybe that's actually creating a diamond.
That's really good to hear. And I think we have Sukhi Achyuta's. You've come on. Welcome. Thank you. I heard you were. We heard just now a little bit, and by the way, to our audience, we will try to get some time in the next 5 minutes or so. There have been a few questions that have been put forward, and we'll try to take those questions. But before we get to that, I wanted to learn a little bit more about the Mayapur Community Hospital, and you've acquired a testing system. It seems that you're really kind of developing this service to the Mayapur community. the fact that you, I remember asking these questions early on, where do I get tested? And it was like, okay, you go to Krishnanagar and you get your swab done, and then they put you in their hospital for 3 days while they send the swab to Calcutta or someplace to get actually evaluated. And meanwhile, you may be without any disease when you went in, but you're got something when you go out. So I think that was something that really did pose a great challenge, and you were successful to get our own testing equipment. So Hari Leela, maybe you could tell us a little bit more about how that was done and the future of developing Mayapur's health facilities.
So probably I would first ask Suki to speak something so that he can speak something. Then I can tell you the story very quickly.
Okay, Suki, lead us off.
I can speak something so that Harila Prabhu can correct it. So it all happened by sweet will of Krishna, as he wanted his devotees who had immense faith on him, and they took the shelter of Srila Mayapur. So I really feel that everything has been arranged by Krishna here. In a situation in which people are dying because of mismanagement in government sector. It's not very old. Yesterday, only one old lady, a Muslim lady, she came with saturation 77, and her blood investigation were suggesting that she might be having corona. We asked her to go for testing, but the price was 2,500, and they told that they cannot afford it. But we started her on the same regimen that we would start for any person whom we are suspecting COVID. But after 2.5 days, when she was not improving, we thought of giving her remdesivir, the IV drug, very well known to have good efficacy. But the cost of one injection is 5,400 rupees only. And that too is not available freely in market. When we tried hard, we found that it is available in Kolkata, but they will not give any bill. So by going through all this process, we came to know that practically it is not possible for us to procure it and give it to her. So I was knowing that the remdesivir is available in government hospitals. So I referred her to government hospital. She reached Krishnanagar district hospital, and in isolation ward, she left her body. So when I called the doctor there, they said like, see, we have a protocol and we have to follow the protocol. If you will ask us to give remdesivir, we cannot give remdesivir. We have been given a list of medicines. That medicines only we can give. Because government has said, you give hydroxychloroquine, you give ivermectin, you give azithromycin. More than this, we are not going to give anything. So now, by this particular case, now I realize that all these arrangements in very short span of time, Krishna gave hands in the form of a few very dedicated devotees here, like Gopijana Govind Das and Santanu Poder. Those who are working night and day, irrespective of whether it is raining, whether it is sun. So all this is a team effort, and it's really a blessing from Krishna that we are able to we have crossed half. Like one big part is already gone, and after this lockdown is going, we are getting another peak of patients from community, including so-called non-devotees and devotees all. And because this whole society has been established by ISKCON. So it's a unsaid responsibility of us to take care of them. And whether they are Muslims or they are non-Muslims, as a doctor, I want to treat all of them. And when I'm not able to treat them in need of some equipments or medicines, I'm feeling very bad, like the case happened yesterday. So I need help from all the devotee community across the world to help us so that we can treat all the people here who are Dhamvasis, irrespective of their present state, maybe from different religion or different ethical background. I need to treat all of them. So it's my humble request to please help us.
Thank you very, very much. I think this is a very important point for you, Hari Leela Prabhu. You can expand on this, that the Sri Mayapur Community Hospital is for the entire Sri Mayapur community. It's not just the ISKCON members, although we do appreciate it very, very much. And that facilities are needed, and somehow you were able to, at least to start with, you've got facility for testing. It's a major achievement. Please tell us more about how this took place. I know there was some appeals.
So the situation was quite grave when we were facing cases and treating. So basically, I went to His Holiness Jayapataka Swami Maharaj, and then I expressed to him a situation is grave. Unless we do something, it's not going to be easy for us to face the situation as we are, because we have good doctors. We have Vinay constantly on telemedicine. We have Dr. Chita running day and night. He has his hands and legs. So we have people who are very, very dedicated. We had good volunteers. Brahmacharis came up very nicely to help, etc. But resources are required. So I went to Srila Jayapataka Swami Maharaj and expressed this. And then he asked me to discuss this situation with his senior disciples' body, which is it's called JPS Seva Committee. So I went to them, and then I'm also part of the body. So I went to them, and then I placed my appeal to them, that saying that this is a situation with Mayapur. We have to do something, otherwise it's going to be really problem. So then they came up with this appeal called COVID Karuna, where we appealed for about 50 lakhs Indian rupees, about $70,000, to buy equipment, and then to buy some medicines, and then to buy some very critical resources, etc. So some money has come in. About we collected about 20 lakhs. I don't know how much it converts into dollars. And then we have pledge of another 10 lakhs, which would go into buying ventilators. We would buy 2 ventilators. We are going to add 2 more ventilators. I'm just in the process of finalizing the models in consultation with Suki, and replacing ventilator with the model, the order for ventilators. These are mostly non-invasive type ventilators, which would be there. And if needed, it could be used for invasive use, but they're predominantly non-invasive type, which is what is now worldwide recommended for treatment of corona. And not only treatment of corona, but also treatment of other diseases where there are respiratory illness related diseases. So that's the next important resource. Then we have medicine, quite expensive. So that's only one part. But the other part is that we have a hospital which has 9 beds, and those 9 beds are like arranged in a situation where in a pandemic situation, you could just use 3 out of the 9 beds, and if you have to maintain certain ventilation standards and social distancing, the medical distancing required, etc. So we are severely resource crunched. So we also have on pipeline a 50-bed hospital, which would cost us about 14-15 crores to build. Mayapur management has allotted already the land for it. MEB has already seen the plans of the hospital, and they have given their go-ahead. And we need to now have the resources to manifest that hospital. Of course, it is a hospital for the whole world, because Mayapur, the whole world comes to Mayapur. Even during this pandemic, we had devotees from different parts of the world stranded in Mayapur for months together. And we were feeding them, we were accommodating them for free, we were feeding them for free, we were not charging them. And then when some of them got sick, we were also treating them for free. So when there is a hospital here, we may think that it's a Mayapur hospital, but no, it's not a Mayapur hospital. It's a hospital which actually belongs to the whole world, because whole world comes here. All the leaders come here. During the GBC time, the entire leadership is here. And during the non-GBC time, during the non-festival time, continuously leaders are coming here with different groups, traveling around, having so many things. So it's a very important resource. Somehow or other, by Krishna's mercy, we have managed so many years without hospital or without this critical resource. Not much to show or not much to do, but now it looks like that the pandemic has brought this renewed call for having a full-fledged, at least I would say, secondary care hospital in Mayapur. So that's our next goal. Once we have some very critical resources put inside. So we have a short-term goal. The short-term goal is to collect enough money for, now we have the testing machine. We have some pledge for ventilators, which the money would materialize when the ventilators come. That would take about 4 weeks for us from the time of ordering. I'm planning to place the orders tomorrow, or maximum by Monday. I would place the orders for the ventilators. Then we need money for subsidizing testing. This is another important thing, that the testing is still expensive, and we need to subsidize testing for everyone. So we need money for subsidizing the testing, and we also need money for. We are actually heavily subsidizing the treatment in some of the private hospitals. If you go to Calcutta or anywhere in India, the treatment in a normal, simple private hospital for COVID 14 days treatment would cost nothing less than 5 lakhs to 6 lakhs, and then plus the tests, plus the doctor's fee, plus this, plus that. So normally they would end up with a bill of about 7-8 lakhs in a normal hospital. In specialty hospitals, they would end up maybe 3 times, 4 times that bill in specialty hospitals. But we are actually almost treating at 1/10 of the cost of a normal hospital. So we are heavily subsidizing because our doctors work literally free for us, and then we have a volunteer spirit in serving the community. So the cost of treatment is heavily subsidized, but still we need medicines. Medicines are having their own expense. Then testing, and the testing kits are expensive, so we need to actually subsidize. So that's an important thing which we are looking for, and we're also looking for buying some subsidy for buying medicines. So we had requested about 20 lakhs. That would be I don't know whatever in dollars. I can just plug in the numbers. About $30,000 we had requested for subsidizing the testing and for buying some critical medicines. Hopefully that also would come by Krishna's mercy. And then the big hospital itself. So that's the next thing to do. That's the next logical step with proper facilities, with proper isolation facilities and beds, etc.
I think this is one of the difficulties of doing interviews and broadcasts in Mayapur, is that sometimes power goes off or something goes off. And I was just about, but I think perhaps Sukhiya Chuta Prabhu, you can tell us if someone wants to support this effort, how do they do that? Is there a website? Is there an email address? What? Because I'd like to put it up there as it's part of this broadcast. How to support the Mayapur Community Hospital? Can you give me an email address, or what do you suggest?
First thing I will suggest, like very sincere prayer for development of Mayapur Community Hospital. Everyone can do.
Everyone give us prayers. Yes.
Yeah. And next is the Harila Prabhu. Can you share the details on which those who want to?
When you came offline, I was just going to ask you, if someone wants to contribute, how do they do that? Is there a website or an email address?
Yeah, definitely. I would write on the chat box my email address.
Okay, and then I'll put it up so everyone can see it.
So
we're running out of time, and I know there's another broadcast scheduled for right now. So I think we're going to have to end. So that and apologies to everyone who had questions, but we will put the link in the comments so that you can. And I invite all of you to also go online and see the comments and check it out.
Yeah, definitely. I saw a few questions. Maybe Vinay and Suki can get to the web page and answer those questions which are medical in nature. Anything which is social in nature, I would go and answer those questions. I'll also put out some details on the website about the hospital project. I would liaise with you to actually do that, and then I'll also put some email addresses where they can communicate.
Okay. Thank you, everyone, again. It's been really a great pleasure and very enlightening. And I hope that this will get shared, especially in our Mayapur community and around the world. Thank you. Hare Krishna.
Hare Krishna.
Thank you very, very much. Jai Shri Prabhupada.
Ram, Ram, Ram.